In addition to tending to their patients' medical needs, healthcare providers are sometimes tasked with navigating trickier topics by way of what can be difficult conversations. Preparing students for this aspect of their future professions is being increasingly emphasized in their formal education. At the University of Tennessee Health Science Center, two nursing faculty, Dr. Janet Tucker and Dr. Lisa Beasley, have developed a simulation to help students prepare for patient discussions around intimate partner violence. They, along with Dr. Jackie Bradford, formerly with the physical therapy program at UT Health Science Center, recently published a paper, Simulation Expert Modeling to Teach Sensitive Screening in Nursing Education. It was published in the Journal of Nursing Education. Welcome to Teach Well, Learn Well, a podcast series highlighting the scholarship being published by members of the University of Tennessee Health Science Center's community about effective ways to teach. I'm Tom Lochner of UTHSC's Teaching and Learning Center. Each month, we interview members of our faculty about their research and its impact on the higher education community. Join us as we discuss this fascinating exercise, why it's an important part of the nursing curriculum, how it teaches future nurses the importance of both verbal and nonverbal communication, the challenges involved in developing a simulation around such a sensitive topic, and how the exercise can be applied to other situations. Welcome, Dr. Carter.
Thank you, Dr. Loeffner. Dr. Beasley and I are very happy to be here to share our simulation we do it with students.
Welcome, Dr. Beasley.
Thank you so much. Glad to be here.
We're looking forward to this conversation. To start out, Janet, can you just briefly summarize your paper and talk about why the topic is so important?
I teach in the maternal child nursing course in our baccalaureate nursing program, and intimate partner violence is very prevalent in our society, and students can understand the prevalence and the importance of screening when they admit someone to the hospital. But we know that students struggle with communication skills. So Dr. Beasley and I have presented this modeling of the screening interview for several semesters when we decided we need to write this up. So it was accepted and published and as a teaching strategy, and we found it very effective after we did it several semesters. So that was our reason for the dissemination.
You do the simulation unannounced. I'm sure it comes as a surprise to your students all of a sudden have this happening in front of them. What were the observed effects of this approach on student engagement, realism perception, or immediate learning compared to a pre-briefed simulation?
So students, as you mentioned, they don't expect this simulation to occur in the middle of this didactic course, and information about the prevalence of intimate partner violence has already been given to them prior to this. So they're prepared, but they don't really know that they're prepared because they don't know that it's going to happen. So the faculty usually rolls the patient in, and I'm the patient, to be transparent. The faculty stops the class, she puts on her white coat, and at that time we ask the students to enter into this simulation experience with us. We explain that the patient has come to the ER after experiencing a fall. She happens to be expecting, I think, around 20 weeks pregnant. And to aid to the realism, since I'm the patient, I will put, it's called moulage. It's makeup. I'll put it around my eye to make it a little black looking. I put a bruise around my ankle to kind of say this is where I have fallen. I'm exhibiting the mannerisms of someone who may be in an intimate partner violence situation, such as pulling my hair down over the bruising that's around my eye, kind of pulling my coat up. I have a sling on because I've kind of fallen on my arm, or we say that's what's happened. I think I've also worn sunglasses in the simulation as well. And so with it being so unexpected and we don't burst all in, we quietly enter the room and make the announcement. But with it being unexpected, they're just very captivated with the experience.
You mentioned that you are the person who acts as a patient and somebody else is wheeling you in. There's the professor who is facilitating the class. What kind of preparation do you go through in order to prepare for that event? Is there a script?
We do have a script, and I try to follow it. I think I'm the one who gets off script most of the time, but Dr. Tucker tries to keep me focused and on the script, and I'll just go by what I think is memory sometimes. And sometimes I'm right, sometimes I'm wrong, but we do have a script for sure.
And we've done this enough that we've worked with each other and are very comfortable, so we can, if she throws in maybe some information or fact, I can go with that, as the nurse conducting the interview.
So what are you mentioned the makeup, and you mentioned, sort of what you do to yourself, and you mentioned the script. Are there other things that you do to make this as realistic as possible?
Well, unfortunately, as a maternal child nurse, I'm very familiar with how a woman experiencing violence from their partner presents in that clinical setting. And Dr. Beasley is a nurse practitioner, so as a provider, she is also aware of that clinical presentation. And along with the research in our script, we have examples of where our patient is denying that, stating it was an accident, denying that her spouse was involved, making excuses, blaming herself for his anger, doesn't immediately disclose what happened, and also are reluctant to leave the situation even when resources are offered. One of the things the research tells us is that women will usually present to a healthcare setting at least 4 or 5 times before they'll really access the resources. One of the things that we try to say several times to our students in this undergrad course, that healthy women in their 20s and 30s may not have any other healthcare providers. So if we miss this, we've really missed an opportunity to help women.
Let's talk about the debriefing. What kind of framework do you use? What kind of techniques did you use in order to facilitate the discussion and reflection? Are there strategies that you used? How do you deal with the emotional, the ethical aspects of it? What are some things that you have to work through in order to prepare for that debriefing?
Well, Dr. Tucker and I have used this educational strategy in 2 colleges, another nursing college in this city. And both times we've collaborated with experts in simulation so that they could help us have a more realistic and more evidence-based approach for teaching. And following the simulation and the screening interview, we do hold a debrief with the students. And the debriefing was developed with one of our experts in simulation at the university to provide a safe space for the students to discuss. And the first time it was presented at UT, Dr. Tucker asked our simulation expert to attend to focus on the students' reactions. She sat in the audience and was very observant about what was going on. Students are asked what they noticed about the nurse-patient interaction, the information the nurse obtained, how the nurse created that safe environment, and what the nursing interventions were during the simulation. The students asked lots of questions. They shared personal experiences. Some of them, unfortunately, do have those of this type of situation, and interacted with faculty after class. And they always talk about how real it was.
So during the debriefing too, do you have observations about how students process the information, how they came to understand it and experience it?
They have overwhelmingly commented every semester that they can read about it, but it was the example of that interaction that helped them have more confidence. They still might be anxious that first time, but they really appreciate the modeling. And as we ask questions about what they noticed about the nurse-patient interaction, what I'm hoping to get them to talk about is I do things like I sit down with the patient. I make sure we're in a private room. I'm trying to connect with her and exhibit empathy before I start asking some of those hard questions. So we want them to pick up on the fact that we provided a safe space for the patient that was also private and confidential. And we also have Lisa ask a couple of times, well, where is he? I don't want him to know this, or is he going to see my medical records? So we have her exhibiting that anxiety about not feeling safe, even in the healthcare setting.
You have a class of 30 to 60 students, So if you're looking at other universities who may have larger classes than this, or different types of universities, different types of students, different kind of learning spaces, what kind of issues might there be to scale this to those different environments?
Our pre-briefing, the interview, and the debriefing, that all lasts just about 30 minutes. But it could be shortened, it could be expanded. It just is based on the learning objectives and what the topic might be. This simulation doesn't need to be in a simulation center because it requires very little equipment. It's a strategy that can easily be adapted with faculty preparation. And in most health science colleges, there are assessments that should be conducted with sensitivity and privacy, like this one. So it could be adaptable to a variety of courses. And as you've mentioned, we've done this with cohorts as little as 30, and at another university, we did it up to 150. And it had about the same result or similar result. It might be helpful if we were to break the students up and have other faculty sort of supervise the groups and then do a larger report out for the debriefing.
So you have smaller groups talking together about what they experienced, and then with some sort of facilitator present.
That could be an option for sure.
Mm-hmm.
Yeah.
I'm sure there's lots of different ways that have been used in order to get the same results of having students talk about IPV. Have you compared this method with other methods, or have you thought about the differences between how you prepare students for these conversations?
Well, typically in a lot of our healthcare education, the bulk of their education is lectures. And we might have some different activities to simulate discussion, and we expect them to read beforehand and all. And there's a lot of information that they, of course, can obtain that way. When it's something related to communication skills, we have found that the ability to see it modeled by experts, clinical experts, and students have said, you gave us the language, you gave us the words. I haven't seen a lot of research on this topic as far as simulation in the class and that modeling and then the outcome. So our data that has shown us this is an effective strategy is really the students' discussion with us and letting us know that I'm more comfortable now. You gave us the language.
You mentioned earlier that there are probably students in your classes that have experienced this situation themselves. How do you prepare for them, possibly these triggers that it might cause? What kind of resources do you provide for them? What kind of expectations do you have? Or how do you communicate with them, sort of how to prepare for this?
Well, one of the things that our college is trying to do a better job with is talking to our students about self-care as they begin their nursing profession. And so we end with taking care of yourself and accessing the resources. We talk about the prevalence, and I'll say very openly, in a class of 50, I wouldn't be surprised that there are quite a few that have either experienced intimate partner violence, have gotten away from that situation, or have a very close friend or family member who's experienced it. So if you find that you have some unresolved feelings about that, remember, we've got free counseling here. And so we end with that, encouraging them to access the resources available to them. We also we talk about perinatal loss and grief in our course, and as nursing students, that also may be a trigger that brings up unresolved grief or loss. So we talk about, again, accessing help so that you can be the professional you need to be. And I think as nurses, we're starting, we're not there yet, getting better about our own self-care. And as a college, we are doing that with ourselves. It's part of our evaluation that we are expected to have a self-care goal every year. So we are trying to be better models of that and also pass that on to our students. And we do this simulation usually week 3. We wouldn't ever want to do this the very first class of the semester because we need to have already established a little bit of rapport with our students so that they can feel comfortable talking to us. Those are all the ways that we have tried to create a safe environment. And as Lisa mentioned, when we had our simulation expert come that first time that we did it here at UT, I wanted her to really watch the students, because when you're involved in the interview, I'm focused on Lisa as the patient, so I'm not really seeing all the expressions and response of the students. I can tell that they're engaged, but it was nice to have our experts say they were engaged, they were sitting on the edge of their seats, and the fact that they asked so many questions, they entered into the discussion during the post-briefing, and the fact that so many came up afterwards to talk to both of us was evidence that we had created a safe environment where they could discuss it with us. So I'll admit, as a faculty, it's always a little bit anxious when we bring up a topic that could be a trigger themselves. And when we talk about perinatal loss and grief, for example, I know the statistics of how common miscarriages are. So I know that in a class of 50, I may have a few that have experienced that. So we want to make the ability to access resources as very acceptable, very, please use the resources here. They're here to help you be a better nurse and take care of yourself.
And I would imagine that part of that environment about empathy is is how you conduct the course leading up to that simulation as well. You can't say, teach. Okay, today's our empathy day, and then go back to regular teaching. It's an environment that you talked about that you're creating that makes students feel safe about anything that you're talking about.
Yeah. Students will often say their faculty are intimidating, or they might be afraid to approach, and I've thought about that a lot. I've thought, I'm come early, I stay late, I try to interact with them, but really it's our position. It's that position of that person who has authority, who is giving their grades. So I feel like as faculty, we're the ones that have to work harder to connect with our students. And it can be something as simple as making sure you get to class 15 minutes early. Oh, how was class today? Oh, y'all have an exam after this. And just, students sometimes can be very funny. They'll tell you things like maybe a little child was. And towards the end of the semester, sometimes I'll have a student say, I was so scared of you initially, but you're like a real person.
What about the long-term impact of this? So you're in a classroom and you go through the simulation, and then students are going to go into the clinic. Have you noticed any differences or heard any difference about how students, they go into it and they've experienced this for real now, that they're better prepared, they respond in a better way? How has this improved their communication overall and when they start working with patients?
So we really don't have any evidence that it has, and other than after the simulation, they come up to us and they tell us that they feel more confident, that if they're approached with this situation, or when they do have to ask these kinds of questions, that they're more confident that they can do this, because Dr. Tucker does just such a wonderful job of, she's very nurturing. She makes me feel comfortable as the character who is experiencing the intimate partner violence. And I think when they see that, they see how she models this behavior, which is what this, the entire simulation, the crux of it is, that they're like, oh, I think, yeah, okay, I see how she's doing that. I can do that. And they express that. So I think there's opportunity for us to figure out how we can see or learn more about how this has affected them in their practice. Another faculty member and I were talking about how nurses are usually one of the frontline people that a patient would encounter when they're coming to the hospital, coming to a facility. And nurses are the ones who conduct the admission history. And there are lots of uncomfortable questions that they're going to have to get through in this admission history. And hopefully this is something that sets the stage for them to be able to be comfortable asking, have you thought about killing yourself? Or have you thought about committing suicide? Or is your husband or partner abusing you? And instead of saying, or, phrasing it in a way that doesn't open up, the patient to be able to be honest about it. I know this isn't happening to you, but is your husband or your partner abusing you? I just have to ask this question. I know it's not happening to you. We never want a nurse to say that. We don't want students to get that, ever learn that's
Right.
the way to ask those questions. They need to be prepared for the answer too. If it's a yes, they need to be prepared for that.
And we do in the debriefing, we talk about what happens when she says yes. Then, as a nurse, what are the ethical responsibilities? Who can be involved? Again, that just struck me of how much help they need with communication examples and opportunities to practice that. And we have our skills checklist and our health assessment and all of our competencies where they have to demonstrate this skill and they're able to put in a Foley catheter and start an IV. I think we need to focus as much on communication skills and for them to get just as comfortable before they walk into the hospital, just like we do with our other skills.
Mm-hmm.
And it occurs to me listening to you that it's not only the verbal communication skills, but the nonverbal communication skills are just as important, right? How do you react when somebody tells you something that is confidential and not being judgmental, and just your facial expressions, your body language, and everything is just as important.
Mm-hmm. And when I was teaching, I taught undergraduate nursing for quite a while before coming to UT and teaching in the DNP program. I would always say to students, I can teach anybody how to start an IV. Mm-hmm. I can teach anybody how to put in a Foley catheter, but I can't teach them why. I can't just pull someone off the street without the education that we're providing students of the why we're starting the Foley catheter, why we need to start the IV. Those are the things that they need to know for these critical thinking, to develop this critical thinking, is the why of it. And that might be kind of a soft skill in a way, is the why of it, but that's the most important, to me, that's the most important skill, is the why.
And teaching in a specialty course, I know that every student in the class may not want to be a maternal child nurse, but I often say to the students, if you leave this course and never want to take care of pregnant women, that is totally okay. But I really care more how you think, and I care more about the type of nurse you are. I can't teach somebody to care. We can teach them skills. And that's what I try to communicate to the students, whether it's a screening interview about intimate partner violence, or maybe you walk in with a patient who had a miscarriage yesterday, or had a full-term stillbirth, and you're like, oh my gosh, what do I say to her? And I try to encourage the students that it's not the exact words, that if you come across as caring and sincere and empathetic, you're not going to say the wrong thing. I think sometimes they can get so focused on what should I say exactly. And I actually used to give this lecture to our OB residents. I worked in a high-risk clinic, and really same thing with our physicians. I think we're getting better at their education as far as communication, but what do I say to this patient? And when I would tell these residents, when you deliver that news, sometimes that patient is going to remember that interaction the rest of their life, and which can be alarming to that resident to hear that. But then I go on to say, if you're sincere, if you're real, if they know you care about them, you're not going to say the wrong thing. So it's a big responsibility. And in fact, Dr. Beasley and I, as we were walking over, we talked about how, as nurses, we've been nurses quite a minute here, and the nurse that we are is the examples we saw in others and the mentors that we had. And like when you would see a nurse who was really, maybe she de-escalated a situation so beautifully, you're like, oh, I want to be like that. So, but sometimes we don't get an opportunity to learn those communication skills till we're out in practice. So the more we can build our students' confidence with opportunities to practice, opportunities to see the modeling we want them to see, I think we can increase their confidence, and they will maybe start off their practice stronger than we did.
So you've been doing these simulations for a while now. You've got this down to an art. What's next? What are some unanswered questions? What are some things that you want to do as next steps?
It might be a good idea, if it's possible at all, to bring back former graduates, two or three of them, do a little bit of a panel interview, after they've been out maybe practicing a year, bring them in maybe after the simulation, or I don't know, and have them to talk about their experience and how this maybe did help them
That's a
with
good
their
idea.
communication.
Dr. Tucker, Dr. Beasley, this has been a fascinating conversation. I really appreciate the work that you're doing to help future nurses be able to communicate better, especially in difficult situations. And I thank you again for your time.
Thank you.
Thank
we
you.
enjoyed it.
Yeah, it's great.
And that's this month's episode of Teach Well, Learn Well. Thank you to Dr. Janet Tucker and Dr. Lisa Beasley. I'm Tom Lochner, the Teaching and Learning Center at the University of Tennessee Health Science Center. Until next time.